someone has periodontal disease, there's a variety of ways to treat that, and one is the traditional surgery, and now we have LANAP. The biggest difference between the two is traditional surgery is subtractive, meaning that if you have gum disease and you have that deep pocket, say like a 9mm pocket, you can't clean the bottom of that pocket. So in traditional surgery, they know that you can clean 3mm worth of pocket. So they whack off 6mm of gum tissue, and if there's any bone that's underneath that's irregular, they grind it away. So they're taking away bone, they're taking away gums, and you end up with a long tooth. You end up with sensitivity in these areas that are difficult to clean. LANAP is not subtractive. Basically, LANAP is taking the body's own healing response and allowing it to work, where it actually fills the bone in, and then the pocket shrinks back up by taking the infection out. One of the biggest benefit of LANAP for the patient that has gum disease is that it isn't an additive procedure. Basically, the body's healing itself, but after you go through this procedure, one of the biggest things is it's not really that painful. Matter of fact, my biggest problem when I treat patients with LANAP is I want them to take something like ibuprofen for 2 or 3 days to help regenerate, and I call them that night to see how they're doing, and they haven't taken their ibuprofen because it's not hurting at all. And I have to get on them. It's like, okay, you need to take that ibuprofen, but they're not in pain, so they don't understand they need to take it. So one of the big things, it's really not that big of a painful procedure, and you don't end up with a lot of sensitivity. During the time that I've been doing LANAP, there are little subtle things that I do with it that kind of makes me a little different. And one of them is called a perioscope. It's just actually a endoscope. It's a little minor little fiber that I can actually use to go down into the sulcus and see what's going on. See if there's anything that might be like a fracture or a little piece of calculus that we're not able to get, and I actually do the whole procedure under a microscope itself. So there's little things that I do differently, and things as simple as just using the T-scan to get your occlusion adjusted so you're not putting too much pressure on one particular tooth. So there's a lot of little subtleties that we do that actually lead to a really big difference in the end.